What is COPD? Causes, early signs, and how to control it for a healthier life every day. Welcome to the Senior Health Channel. Did you know? Many people have COPD for years without knowing it. They think shortness of breath, frequent coughing, and fatigue during exercise are just due to old age. But the truth is, COPD is a chronic lung disease that progresses silently, and by the time it's detected late, the lungs are already irreversibly damaged. In this video, you will understand what COPD is, and what you can do today to protect your lungs. A. COPD doesn't appear suddenly, it's built up over many years. What is COPD? The true nature of the disease. Why COPD is more dangerous than you think. First, COPD is not a disease, but a process of lung deterioration. COPD, chronic obstructive pulmonary disease, is not like the flu or acute pneumonia. This is a long-term, insidious, and continuous process of lung function decline. Simply put, the lungs are like an oxygen pump. COPD causes the airways to gradually narrow, and the oxygen exchange surface is permanently destroyed. When you feel short of breath, the damage has actually been happening for a long time. Secondly, the two attacks that destroy the lungs in COPD. COPD consists of two main components, which usually coexist, not separate. Chronic bronchitis, the airways become progressively blocked. Nature, prolonged inflammation of the bronchial passages. The walls of the tubes thicken and narrow. Mucus glands become overactive, producing excessive mucus. Consequences: difficulty in and out of the airways. Thick mucus blocks the airways. Bacteria easily multiply, recurrent infections. Visualization: it's like blowing air through a narrow straw full of mucus. Here's why people with COPD: persistent cough, coughing up phlegm every morning, frequent respiratory infections, emphysema, lungs gradually collapsing from the inside. More dangerous aspects: small air sacs, alveoli, are destroyed. Loss of elasticity, cannot retain oxygen. Consequences: air enters but doesn't escape completely. Air traps in the lungs. Patients feel suffocated and have chest tightness. Imagine, like an old rubber balloon. It inflates when blown on, but deflates very slowly, and is no longer elastic. Here's why people with COPD: exhalation is harder than inhalation. Breathing requires effort. Always feeling short of breath. The most dangerous aspect of COPD many people misunderstand. COPD cannot be completely cured, but its progression can be controlled and slowed down. The problem is, when you have clear symptoms, lung tissue has been irreversibly damaged. Lung tissue non-regenerative. Therefore, early detection equals preserving the remaining healthy lung tissue. Late detection equals living with lifelong limitations. 2. Why is COPD becoming increasingly common? Not because people are getting weaker, but because the lungs are constantly attacked. COPD doesn't come from one shock, but from thousands of days of minor damage. Cause number 1. Smoking, the leading cause of lung damage. Why does smoking cause COPD? Tobacco smoke contains over 7,000 chemicals, hundreds of inflammatory substances, many substances that destroy lung elastic tissue. Each cigarette causes mild inflammation, partially destroys alveoli, makes lungs age faster than their actual age. In fact, 80 to 90% of COPD patients have smoked. Smokers breathe like people 10 to 15 years older. Even more dangerous, passive smoking also causes COPD. Living with smokers, working in a smoky environment. Cause number 2. Air pollution, the silent enemy. Not smoking doesn't mean you're safe. Common sources of harm: PM 2.5 fine dust, coal and wood stove, smoke, traffic exhaust fumes, industrial chemicals. Dangerous characteristics of fine dust: so small that it penetrates deep into the alveoli, causes chronic inflammation, inability to cough up. Phlegm, lungs are chronically inflamed for many years, leading to COPD. Cause number 3. Age and genetics, weak foundation. Age: after 40 to 50 years old, lung elasticity decreases. Tissue repair capacity decreases sharply. Small damage is not fully repaired. Genetics. Some people are born with weak alveoli, lack of enzymes that protect lung tissue. Even light smoking can easily lead to COPD. This is why some people smoke heavily but don't get it. Some people smoke little but get it severely. COPD is the result of daily wear and tear on the lungs, not a sudden accident. COPD symptoms. Why does the disease progress before the patient realizes it? Early stage, the trap of subjective perception. Symptoms: persistent cough, morning phlegm, short breath on exertion. Patients think it must be due to old age. Because of the weather, coughing is normal because of smoking. This stage is the easiest to overlook, but it's also when treatment is most effective. Moderate stage, life begins to be limited. Wheezing requires stopping to climb stairs. Walking becomes slower. Lungs have now lost some irreversible function. Severe stage, when breathing becomes a burden. Difficulty breathing even at rest. Chest tightness. Oxygen dependence. At this point, treatment is only maintenance therapy. Quality of life is significantly reduced. A very dangerous mistake. It's just that I'm old and my breathing is weak. No one gets old and has difficulty breathing. Difficulty breathing is always a sign of illness, not age. Specific actions needed. Immediately. This order is extremely important. Doing it in the wrong order will drastically reduce effectiveness. Step 1. Prevent further lung damage. This is the most important step, but often overlooked. COPD is incurable because lung tissue has already been irreversibly damaged. But Part P, while you're still alive, you can still be protected if you don't stop new damage. All medication, breathing exercises, and nutrition will only be temporary fixes. First, quit smoking. Why is this the breakdown for COPD? When smoking, every day the lungs become inflamed. Further alveolar damage occurs. Airways narrow gradually. It is very important to understand, when quitting smoking, inflammation significantly decreases after a few weeks. The rate of lung function decline slows down to almost that of a non-smoker. You cannot regain lost lung capacity, but you retain the remaining lung capacity. Common mistake: I've smoked for a long time. Quitting is pointless. Crossmark. Wrong. Quitting smoking is always beneficial, regardless of the stage. Secondly, avoid dust and smoke, because COPD lungs are no longer able to filter themselves. In healthy people, citricals in the lungs sweep dust out. In people with COPD, citricals are paralyzed. Dust and bacteria accumulate in the alveoli. Therefore, PM 2.5 not only causes shortness of breath, but also triggers chronic inflammation. Practical solution: wear a fine dust filter mask when going outside. Avoid peak pollution hours. Do not burn charcoal, incense, or garbage indoors. Thirdly, house ventilation, fighting enemies in the shadows. Many people don't know mold, moisture, dust mites are the causes of severe COPD flare-ups. For COPD lungs, inhaling mold equals strong irritation, easily causes wheezing, infections, COPD exacerbations. Principle: dry house, sunlight, natural ventilation. Failure to prevent new damage equals COPD progresses faster each year. Step 2. Proper treatment. No self-medication. Medication doesn't cure, but helps you breathe. First, bronchodilators, opening the way for air. Mechanism: relaxes bronchial smooth muscle. Wider airways, easier airflow in and out. Patients often see less chest congestion, easier movement, less effort required when breathing. Mistakes: only used when shortness of breath is severe. Not used regularly as prescribed. Significantly reduced effectiveness. Second 2. Anti-inflammatory drugs, extinguishing the smoldering fire. COPD is chronic inflammation, not acute inflammation. Anti-inflammatory drugs reduce airway swelling, reduce mucus production, reduce the number of acute exacerbations. Warning: Do not increase the dose without consulting a doctor. Do not stop treatment when you feel better. 3. Oxygen therapy. Not everyone needs it, but it is very important when needed. When do you need oxygen? Low blood oxygen levels, shortness of breath even at rest, heart problems are beginning to develop. Oxygen is not addictive. Oxygen helps reduce the burden on the heart, reduce the risk of heart failure, sudden death. Common misconception: using oxygen means you're going to die. Crossmark. False. Using oxygen at the right time helps you live longer. COPD is a chronic disease. Medication is a long-term companion, not a short-term emergency. Step 3. Recovery and strengthening. Lungs. This is the crucial step for quality of life. 1. Breathing exercises. Because COPD patients breathe incorrectly without knowing it. Why do COPD patients breathe incorrectly? In a normal person, natural, complete exhalation, lungs collapse, releasing all old air, creating room for new oxygen. In a person with COPD, narrow airways plus loss of elasticity, incomplete exhalation, old air trapped in the lungs. Consequences: lungs always inflated, feeling short of breath even while breathing. The faster the patient breathes, the more suffocated they become. Pinch lip breathing. A safety valve for COPD lungs. Breathing technique: inhale through the nose, 2 seconds. Pinch lips as if whistling. Exhale twice as slowly, 4 to 6 seconds. Scientific mechanism: creates gentle pressure in the airways, prevents premature bronchiectasis, helps old air escape more easily. Clearly visible benefits: reduces air trapping in the lungs, reduces suffocation, reduces panic during shortness of breath. Attacks: helps patients regain control of their breathing. Should be used when climbing stairs, walking, experiencing shortness of breath, breathing, feeling nervous, anxious. Abdominal breathing. Diaphragmatic breathing, utilizing the remaining healthy lung tissue. Problems for people with COPD: using too much chest, neck, and shoulder muscle to breathe. These muscles consume a lot of energy. The more you breathe, the more tired you become. Abdominal breathing helps activate the diaphragm, the main respiratory muscle, driving air to the bottom of the lungs, where oxygen exchange is best, reducing the burden on the heart and accessory respiratory muscles. How to practice: place your hands on your abdomen. Inhale, abdomen expands. Exhale, abdomen contracts. Chest barely moves. Key point: no need to breathe quickly. No need to breathe excessively deeply. Just breathe correctly, slowly, evenly. Secondly, light exercise, because COPD is not just a lung disease. The dangerous, vicious cycle of inactivity. When people with COPD fear shortness of breath, less movement, more sitting, avoiding exercise. Consequences: weak muscles gradually, heart becomes less resilient, body uses oxygen less efficiently. Paradoxical result: even light exercise makes breathing more difficult than before. Why does proper exercise make breathing easier? Light, regular exercise helps the heart pump blood more efficiently. Muscles learn to use oxygen more economically, reduces the amount of oxygen needed for the same activity, meaning the same distance, but less shortness of breath. Suitable forms of exercise for COPD. Golden rule: light, regular, every day. No overexertion. Talk test as possible while exercising. Suggestions: slow walking, light cycling, pulmonary rehabilitation exercises. Combine pursed lip breathing during exercise. Common mistakes: only exercise when feeling well. Overexertion followed by complete cessation. Too long rest after an exacerbation. Exercise does not harm the lungs. On the contrary, it helps the lungs work more efficiently. Third, nutrition. Weak lungs are very energy-consuming. Why do people with COPD easily lose weight? Breathing requires more energy than normal people. Loss of appetite due to fatigue and shortness of breath. Easily eat less, but expend more energy. Consequences: muscle loss, weaken respiratory muscles, increased shortness of breath. Protein, the fuel for respiratory muscles. Role of protein: maintaining the diaphragm, maintaining respiratory muscle strength, helping recovery after exacerbations. Suitable foods: fish, eggs, lean meat, milk, yogurt, tofu, soy products. Protein deficiency equals more difficulty breathing. Water and eating habits, detailed but very important. Drinking enough water helps thin phlegm, make it easier to cough up, reduce the risk of infection. Eat smaller meals. Avoid overfilling your stomach. Avoid pushing the diaphragm too high. Allow space for the lungs to expand when breathing. Eating too much. Stomach compresses the lungs. Shortness of breath increases significantly after eating. The order must not be reversed. Step 1. Block new damage. Otherwise, everything else is meaningless. Step 2. Take medication correctly, regularly, long-term, to maintain the ability to breathe. Step 3. Breathing exercises. Exercise, eating, not just to survive, but to live better, more easily, more proactively with COPD. COPD doesn't steal your breath in one go days. It takes away little by little each year, until you no longer have enough breath to live as before. But the good news is, you are not helpless. When you detect it early, treat it properly, and change your daily lifestyle, you can absolutely live with COPD more proactively, gently, and with better quality. Remember these 3 core things. Stop new damage. Otherwise, everything else is meaningless. Take your medication correctly, regularly, long-term. Practice breathing, exercises, exercise, and eat to live better, not just survive. COPD is not a serious chronic disease, but a stern warning that your lungs are sending you. Thank you for watching the video. Wishing you good health, and see you in the next video.